Good evening, Smack Nation. I hope everyone can see this. This is my first time streaming here, but this is Michelle Campbell here, founder of Smack Productions. And typically we have shows once a month. And as you know, we had the Colonel on earlier this month and really aren't scheduled again until August to have another show. However, this issue of COVID-19, it's still here. It has not gone away. In fact, we've seen data in recent days that it is now at peaking and spiking again in many of our states. I thought it was necessary that we bring the experts in. You've seen these wonderful, good doctors before. And I'm not going to go through all the bios and everything because I think all of you know them. But real briefly, we have Dr. Tin on. You've probably seen her before on Married to Medicine. She has a talk show with another doctor, as well as a recently launched skincare line, Famous AF. And so we brought her back because we just love Dr. Tin and we want to hear what she has to say. And the next doctor, you know, Dr. Jaffe's been there since day one when this first broke out and has been consistently reporting back to the Smack Nation on the latest and greatest. So we've asked him to come back. We know that he is the split second decisions expert, and he's got a bunch of other accolades behind him and history working with other types of viruses in the past. So really, without further ado, I just want to get started. I want to open up the floor to the doctors to just put the facts on the line, tell us what's going on. We're hearing different things. We got 35 million cases now in the United States being reported, and over 600,000 of those have been resulted in death. We got a problem still, people here, and we need to really squash some of these myths and these conspiracy theories and just lay the facts on the table. So without further ado, I'd like to turn the floor over to Dr. Tin and then Dr. Jaff.
All right. Well, nice to see you again, Dr. King Joffrey. Okay. Well, that king on it. All right.
I love that. I
got the memo.
I love that.
Thanks, Michelle, for having me again. You look beautiful tonight.
Thank you.
I guess I should have done a little more, but I was rushing from work, so I'm sorry. Sorry to everyone watching.
No, you're looking fine there.
You are just fine. Thank you.
All right, y'all. So let me just say this. Stuff is just not looking good. It ain't looking good. And I'm a bit pessimistic at this point. I'm a bit pessimistic because the numbers are rising. We have new variants, which we're going to talk about in a moment. And we have a problem with getting people vaccinated. And until we do that, our country is now split, the vaccinated versus the non-vaccinated. And until we come together and get as many people, hopefully 100% of people vaccinated, this virus will continue to circulate and circulate and circulate, and it's going to knock us all out. Okay. So right now we're contending with the Delta variant, but do know Gamma and Lambda are already on its way. And the longer we have it in circulation, the more variants will come. Okay. And with more variants, because becomes more ferocious variants. Okay. So this is the problem. So right now we have 83% infection in the USA is from the Delta variant. Okay. 83% of all the infections in the US are from the Delta variant. And I'm sure Dr. Joff is going to talk about this too. The cases, the severe cases, the hospitalized cases are 97% unvaccinated patients. So all those cases that are in these hospitals, 97% of those patients are unvaccinated. So it's ripping through the unvaccinated community, and it's going to take a few vaccinated people with them. Okay. Just so we are clear, we have got to get vaccinated. So what makes this Delta variant, just briefly, what makes the variant this ferocious? So for every one viral particle that we had in our nose and throat with the previous variants, you have 1,000 in your nose and throat with the Delta variant, 1,000. Okay. So it's also faster at replicating. It has a shorter incubation period, 4 days versus 6 days. And it's more infectious at the early stages. So it's just replicating and shedding, and it makes it easily transmissible, highly transmissible, and very contagious. The other thing is it's able to evade the immune system that we have set up. So while the antibodies are over here attacking this one viral particle, you got 1,000 more just sliding right past it. Okay, hitting those human cells and getting in. And because of the mutation of the Delta variant, it has a higher affinity for the receptors in the human cell, that ACE2 receptor that we've heard about. It has a higher binding affinity for that receptor. So it is getting in quick, it's getting in fast, it's replicating like no one's business, and we're shedding it like crazy. So this Delta variant is taking us down, it's taking us out. And the sad part about it is there will be more. It won't stop with Delta. There will be more, because as those things are replicating inside you, each replication is going to have a mutation. And one of those mutations are going to stick. Bump Delta out, and then there's another one. So what's impeding? What is holding us back? What is impeding our vaccination rates? So there's 3 things that I'm just going to talk about really quickly. 2 of which I feel are easily fixable. One is socioeconomics. Rich people have access. Rich people have money to get what they need, and they get the vaccine. Poor people, on the other hand, are still kind of the have-nots. So they looked at, just briefly, they looked at Princeton, New Jersey, and they saw that in Princeton, New Jersey, 75% of that population was vaccinated, majority white and affluent. 75% were vaccinated. They went down to Trenton, New Jersey, mostly Black and Latino, and only 45% of those people were vaccinated. So 75 versus 45. And they're in both majority Democratic areas. So it has a lot to do with wealth. Who has the money? The people, they're going to get the vaccine. The other thing is access, and that's in terms of transportation access. So elderly, disabled, clinic hours, making sure that people can get off work and still get to the place they need to get get the vaccine. The location of these vaccine clinics. Some people, in rural areas, remote locations, very difficult for them to have access to the vaccine. And then there's accessible and trusted sources of information, right? So one thing we don't think about, are we even supplying people with a language they understand, right? If they are going to clinics to get these vaccines, are they talking to healthcare providers that can communicate with them effectively? Do they speak their language, right? Also, are these places offering us call centers? Because believe it or not everybody has the internet. Okay, now I don't know who these people are and where they've been in the last 10, 15 years, but some people actually don't have the internet, if you can do this. All right. Now, those 2 things I feel are fixable, right? You throw some money at it, you get some planning done, and those 2 things can be fixed. But the last thing is what's really holding us back. It's really, really holding us back. And that is politics. This has turned into such a political debate. I have no clue why all of a sudden this has become so political. Maybe it's because people want to get elected into office more. They want to have their 5 minutes of fame. But politics is really skewing the curve as to whether people get vaccinated or not. So 86% of Democrats are vaccinated. 52% of Republicans are vaccinated. 52%. Okay. The number, so clearly we have a divide. Right. And this is also reflected in our country's in the terms of who's being vaccinated and who's not. So I spoke to someone at work. It was a colleague. Now, she's in the medical profession. She clearly understands the medicine behind it all, the scientific research. And I was curious about why she is adamant that she's not getting this vaccine. And I'm not trying to change her mind. I just want to know, why are you not getting it? I don't understand. So what she said was very similar to the propaganda I hear on the internet, social media, of people who don't want to get it. So I want to talk about 4 things, just 4 things that I heard, and give my rebuttal. Okay. This is Britain's rebuttal. Okay. Number 1, what I've heard is, I don't want the government telling me what to do. I don't want the government telling me what to do. Well, here's the interesting part. The majority of the people who say they don't want the government telling them what to do are the same people who allow the government to tell a woman what she can do with her body, pro-choice versus not pro-choice. So I find that very hypocritical. But beyond that, okay, I'm not going to point no fingers at nobody, but beyond that, you live in a society where you have to live under the rules of the government. What are we talking about? Why do you wear a seatbelt? Why do you get insurance? Because the government tells you you have to. So if you're living in this government, there's certain things you may or may not have to do. I know people were saying that, if they try to mandate this, I'm not getting it. Well, you know what? In the 1800s, they mandated vaccines for smallpox. And what did we do? Oh my God, we eradicated it. Oh my Jesus, I can't believe that happened. But my point is, if you live in this society, there are rules and there's laws, and you can decide for yourself what you want to follow, but there will be repercussions. So moving on to number 2. I hear that they're putting chips in us. Okay. The vaccine is putting chips in us. And to that, I say, you've already been chipped. It's in your cell phone. Okay. It's in your cell phone, people. If it's not there, it's in your internet service. It's in the computer or the laptop you open every day. It's also in those satellites that hover over us every day. So don't even worry about that. And if it's a chip, as a matter of fact, if there is a chip, I'd be happy to give it to my children because I would love to chip they ass. If given the choice, my kids will get chipped. Who's with me on that one? Okay. Because you ain't saving my kids, my children. Chip them. I'm down for the chip. Who's not down for the chip? Okay. The other one. The government created this. The government. Well, that might be true. Whether it's our government or somebody else's government. That is a possibility. Somebody's government may have created this. If you look at the CDC, you go down in the CDC's basement, they are testing all types of viruses and things that can kill us in a second. That's what they do. That's their job. This is an uh-oh moment, an oops moment, because whatever they tested got loose. So the decision to be part of the solution makes more sense. Like, okay, it got loose, but that has nothing to do with whether you're part of the solution and saving yourself and saving everyone else. So again, to that, I say, get vaccinated. Let them figure out who started it, where it came from, make sure it don't ever happen again. That's someone else's job. But the medical society, the medical professionals, the researchers, our job is to find the solution and give that solution to the public. And that's what we're doing. So that's apples and oranges. One has nothing to do with the other. Whoever started it, wherever it came from, is irrelevant to the solution. The solution is get vaccinated. And then lastly, and I'm going to be done, and then Dr. King Joffrey can get on up in here. The last one I heard was they don't trust the government. The government is pushing these vaccines and pushing this agenda. I don't trust them. I just don't trust them. Well, let me just say this. This is not a political movement. This is a medical agenda. This is not political. And it's unfortunate that people in politics have turned this into a right versus left. It's unfortunate that, the right wing is saying this is Biden's vaccine. What did they say? It was something about this is Biden's proposal to fight the vaccine. It's not Biden's anything. It's not Biden's agenda. It's the American public's agenda. And it's the medical professionals who are out here trying to research this, to figure out solutions, and to teach you, inform you, and give you a solution to the problem. It has nothing to do with politics. It's unfortunate that it's turned into that. But I find it very ironic that people have all this information about this vaccine and they don't even trust it when they have zero to no information about the toothpaste they use every day, about the hair care products they put on their skin, about the antibiotics they take, the blood pressure medication they take. They know little to nothing about any of those things that they ingest or put on their body on a daily basis. And they trust it hands down. Okay. You can't tell them that Crest ain't better than Colgate. But with all the information we have today on this vaccine, all the transparency we have with this vaccine, people are skeptical. I find that, to me, I don't even know what it is. It's strange. It's very strange. But just so you know, this is not a political agenda. You separate the two. For those of you who are out there who listen to us or listen to your physicians, listen to them, research them. There's plenty of things out there. There's plenty of research. There's data. You can look it up for yourselves. If you are on any political fence, just for 1 second, just take it out of your mind. and go look it up yourself. Research it yourself. This is a medical emergency. This is a medical agenda, and you should be listening to the researchers and the physicians and not the politicians. And I'm done.
Good. You know, that one thing about the chipping, I'm trying to figure out how they did it. Now, I'm an electrical engineer, and I'm trying to figure out how they take liquid, inject it in you, and it formulates into be a chip. If somebody could tell me what that technology is, and I've been in this for a long time too, I've never heard of such a thing. And then there was some YouTube or somebody or a TikTok that a guy put a magnet on his arm where he had the shot, and it was supposed to have stuck to his arm. Like, yeah, they put something in me.
Oh my gosh.
And oh my goodness. And believe it or not, people are believing this. So,
people believe it. I think, you know, even if you want to believe they put something in your arm, okay, fine. But what does that have to do with you surviving? Nothing. Not one damn thing. It has nothing to do with anything. If they put a chip in the arm, okay, all right, well, then we'll deal with the chip later. But right now, if you want to be able to deal with the chip, you got to survive, and that's getting vaccines. And if we don't vaccinate everybody, and listen, our herd immunity in this country is just our herd immunity. It still ain't going to work unless we have herd immunity across the world, because we are a global family, right? We travel, we're all over the place. So if we don't get vaccinations to the countries that need it, we're still SOL. We still won't be able to achieve what we need to achieve. We have to get everybody vaccinated.
Absolutely.
And then we ain't even talked about the boosters and all that stuff, but go ahead, Dr. King. I feel like I should say your name with a British accent. Joffrey, Dr. King Joffrey.
Well,
the floor is yours.
I like to, first of all, thanks, Mac Nation. Thank you, Michelle, my colleague, my favorite anesthesiologist, Dr. Chen. Thank you very, very much. And we can actually stop. We can drop the mic. You did a great job. You covered everything. Let me introduce myself. I'm Dr. Joffrey. I'm a board certified emergency medicine physician. Before anyone gets intimidated, just relax. Yes, I'm an alpha from Hampton. It's okay. Hey, everything's going to be okay. Just relax. An alpha's in the house.
Okay, save us, Alpha. But today we're talking Delta. Okay, Delta is in the house, boo.
Dr. Ted, hey, I love that. Hey, touche. Everyone, welcome. And yes, the world has changed a great deal since the last time that we've seen one another. We have the vaccine. Roughly, there's about 330 Americans in this country, maybe 350, but only about 160 million of them have been vaccinated. And even of those 160 million vaccinated, some of them are not completely vaccinated. Let me tell you what I mean. A new study came out that said for those folks who received the 2-dose regimen, about 25% of them did not go back for that second dose. And prior to Delta, that may have been okay, because after the first dose, you were about 86% protected. But now, with the Delta variant being here, it shows that if you've only had one dose, you're only about 34% protected. So we have a large number of people who are not protected in this country against the Delta variant. Now let's just right side this. Vaccinations. The way vaccinations work are real simple. They inject your body with a foreigner, and then your body develops antibodies, like fighting troops. And those fighting troops are there, so when the foreigner comes back, when you're out in the world, the troops are ready to go. So the troops jump in as soon as you are exposed, and they keep the virus from replicating. You can still be contagious. You can still contract the virus. How the Trump administration rolled this out, and it made people think once you're vaccinated, it's impossible. It's less likely for you to contract the virus. Well, it is less likely, but it's not impossible. We keep hearing the pundits use this term breakthrough infection. Well, that's inaccurate. These are simply infections that we knew were going to happen. Again, let me set it up. You are vaccinated. And yes, you are vaccinated, but it does not completely prevent you from contracting COVID. What it does is it prevents death. Yes, it prevents death. In a UK study and in an Israeli study, 94% of those people who were vaccinated who contracted COVID, 94% of them did not experience death. Another 90%, they were not even hospitalized. Hence, don't look at it as, oh, I contracted COVID and therefore the vaccine's not working. No, that's not how vaccines work. Let's also talk about how contagious this thing is. Dr. Tent, she nailed it. It's about 220% more contagious. It replicates fast, like 1,000 times faster. I like how Dr. Tent said it. You take one drop. If you have one variant of the old one, we call that the wild type. The original one is the old one. One drop is equal to 1,000 drops of the Delta variant. Hence, it's more contagious. It's more virulent, meaning that it can replicate so fast that something's happening now. It's called fleeting exposure. Fleeting exposure. What that simply means is you can walk by somebody and contract it. It's that simple. You can walk by somebody and contract it. This Delta variant is no joke. Now, I know some people saying, well, I don't know about the vaccine. Listen to this. Of those who died of COVID back in May, and by the way, a lot of people do not realize this because we were not up in the 3,000 per day numbers, but about 400 to 500 people on average have been dying per day of COVID in the last 3 months. Since May, about 4,500 people per day. Of those who died of COVID in May, 99.1% of them were not vaccinated. In June, 99.7% of them were not vaccinated. And you heard Dr. Tin say it earlier. The new strain now in this country, about 83% of new infections are by the Delta variant. And we already talked about it. The Delta variant is more contagious and it's more infectious. And there's some data to say it is perhaps more deadly. Look, being vaccinated protects you against death and protects you against being hospitalized. And as a bonus, it gives you some protection against even contracting COVID. Again, some protection against even contracting COVID. Now, I also want to just talk about something just real quick. Dr. Ten, she definitely touched on it. The CDC has made some guidelines, but we've also learned that there is no monolith, there is no corporation, government that's 100% accurate. This is one going to be the few times I've disagreed with the CDC. The CDC got it wrong. Having people take off masks, playing with the mask mandate, and now they've come out today teasing it out. Well, if you're vaccinated and you're in high-risk areas, listen, call this the Dr. Joff rule. Wear your mask in public places, inside, wear your mask in public places, and when you're outside in public places, wear your mask. Yeah. Vaccinated or not vaccinated. It's real simple. You're going to say, well, why? They just said a few weeks ago outside was safe. The Delta variant was not here. We did not have the fleeting exposure. We didn't have the 220% more contagious. We didn't have the 1,000 times much faster replication. And what that means is if you get that one particle, it replicates 1,000 times faster. That means you've got all these 1,000 particles replicating 1,000 times faster. Which means if you walk past someone sneezes on you, someone coughs on you, someone breathes on you, boom, you're infected. It's that simple. So wearing your mask saves lives. Let me also add one more. Again, these are if you all write these down, we're gonna call these the Dr. Joff rules.
Oh, please. You just gotta put his name on something, don't you?
Well, I'm sorry, you're right, Dr. Tim.
Wait, is it Dr. King Joff or Dr. Joff?
It's Dr. King Joff. Or just King Joff is fine. Just King Joff is fine.
King.
We assume en masse, and Dr. Tin will verifies that we assume everyone's COVID positive.
Yeah.
Anybody for you. In healthcare, those of us in healthcare, our families have consistently worn masks while indoor. But this third one I'm going to add, anyone who comes to your house, you can ask them if they're vaccinated, because if they say no, you shouldn't let them in. But if they say yes, You should require everyone who comes to your house to wear a mask. You should require everyone who comes to your house, with the exception of those who live in the house, to wear your mask. And everyone, I agree, we are about to go through some dark days. It is predicted that we will be up to the 3,000 to 4,000 deaths per day by about the middle of September. Things are going to get dangerous again. But for those of you who are vaccinated, at the very most, you will get some mild symptoms. For those of you all who are unvaccinated, there will be a lot of unvaccinated deaths.
Yeah.
I don't say that to be morbid. I say that to be factual.
Mm-hmm.
And then the last point that I want to make is that the symptoms for COVID have changed. And by the way, I've been using, so SARS-CoV-2 is the virus. COVID-19 is the disease it causes. But for the symptoms for COVID-19, they've changed. With the new Delta strain, the symptoms are runny nose, cough, sneezing, congestion. It looks like the common cold. The loss of taste is only present there about 50% of the time. Again, a runny nose, congestion, cough, you feel like you've got the common cold. The reason why I highlight that is because if you have those symptoms, whether you're vaccinated or not, you should quarantine and immediately go get a COVID test.
Wow.
Quarantine and immediately go get a COVID test. And then truth be told, if you're somewhere and you see somebody coughing and sneezing, you may want to walk away.
Okay.
You have your mask on because we are now wearing our mask whenever we leave our house. Yeah. And just to clarify, because I know someone's going to ask you, I'm saying wear your mask outdoor when there are other people around. Otherwise, COVID does not exist outdoor. SARS-CoV-2 does not exist outdoor when no one's around. It's not like the measles. SARS-CoV-2 does not exist outdoor when no one's around. Everyone, this is the time to lean into one another, be kind to one another, get vaccinated, and I would also just settle back in. The indoor dining, I would stop that. The large gatherings, I would stop that. And make sure that everyone who comes into your house, make sure that they wear a mask. Smack Nation, thank you very, very, very much for having me. And I'm glad that the alpha male was here. and Hampton was in the
Delta woman. And the Delta woman.
And the Delta woman. And that was a good one. And by the way, I am a big Delta fan. I got 7 Deltas in my family.
Okay. All right.
See, my line name was Delta Pride.
Was it?
It was, yes.
Oh,
it was.
Okay. All right. Family by association. I see.
That was very, very helpful. And, there's still, I guess, some questions in terms of like the gyms, for example. The gyms have this quote unquote, if you've been vaccinated, you don't have to wear a mask. I recall going to cycling class and literally I looked like a fool, I guess, but I didn't care. I was the only one with a mask on. And one of the guys came up to me and says, "Oh, you're going to keep your mask on?" I was like, "Well, yeah, because somebody in here lying." Yeah. Somebody hasn't had the vaccination and they going around acting like they do. Or they've been.
But even if they had it, like there's just no.
Yeah.
I feel weird leaving the house without a mask on now. Like it doesn't even feel right. It's like driving without a seatbelt. It just doesn't feel like it's something I'm supposed to be doing.
And it's weird because I don't know. I've been to a couple places. I've been back home in Michigan and I've been here in New York, and it's a mixed bag. There's some people that you'll see have masks on at the bank or at the, gas station, the grocery store. But there are quite a few people that are just not wearing it. And I think because they're hearing, like you said, Dr. Joff, the CDC said, well, we don't have to wear it. And now they're kind of backpedaling on that a little bit as of like the last couple of hours. In fact, I think that if the mandate comes back on, it looks like there's some states that are, or cities that are still, they're implementing it. They're just saying, flat out, let's go back to the mask. And, you know, personally, I think it's the right thing to do. We still don't know. We don't still have enough information. While we have a lot of information, and that's why we have these vaccinations to date, there's still just a lot that we still don't know. I think I heard the other day there's a Lambda variant now, or I don't even know what
Gamma
that
and Lambda. Yeah.
Oh,
I think Lambda is in Peru.
Peru and Texas.
Yeah, Peru and Texas. So it's making its way, and we'll see which one wins the war between Delta and Lambda. But
so is what happening like the original COVID-19 or SARS COVID-2 or whatever we calling it, Dr. Joff and Dr. Tin? Is it morphing in different ways in different places? Is it like, you know how like in India was the, Delta was real big, and now we're talking about Lambda in Peru, and now we got Delta here. And is it morphing in different ways in different areas, or what is causing that? Do we know why it's happening that way?
So let me just say this. Viruses do what viruses do. They mutate. A better name for it is called genetic variations. There's 1,000 different genetic variations going on daily. But those, the ones we are concerned about are the ones that go on and spread to other people. Because hence, everyone needs to keep in mind, this is another reason why vaccination is so important. While vaccination does not absolutely prevent you from contracting COVID, it greatly reduces the likelihood. Because every time COVID or SARS-CoV-2 infects someone, there's a likelihood of a genetic variation, also known as a mutation. So as these genetic variations happen all over the world, just in for some reason, and we don't know, in different parts of the country, you get a different type of mutation. In this country, even prior to the Alpha getting here, even prior to the Alpha is the UK one, even prior to the Delta one, we had a California variant going on we had 3 or 4 different California variants. So it's not new. People, don't be surprised. This is not behaving any differently from any other viruses. Viruses do what they do. They mutate. They create genetic variations.
most of them will die. Most of them mutate into something that's just not gonna help that species survive. That's the good thing. But when it does find one, when it mutates to that one, it only takes one perfect virus or mutation, and then that's when it rips through everything.
Yes.
Yeah.
Wow. Well, we got quite a bit of questions, as you can expect. I did have one that came in before the show even started, and it was around approval. And the question was essentially, why do we not have FDA approval on the vaccination?
Well, that is a long, rigorous process. And so because no one wants to skip any hoops, that process has already been initiated. The data has already been gathered. It's very likely that will take place towards the end of September, hopefully earlier. Then the next question is, so why are we using it? Could you imagine if we had waited until we had gone through the process? We would be well beyond 609,000 deaths. Yeah. Hence, since we had all the data, we were able to start vaccinating through our emergency use. And also, just keep in mind, we have even more data. We have vaccinated well over 160 million people in this country, and it looks like we're over 500 million people across the world. So we have plenty of data.
Yeah.
Very good. Okay, I'm going to go right down the line here with some of the questions and comments. This is a general comment. Most of the same people not getting the vaccine get the flu shot every year, though. Shaking my head. That's just a statement,
Go figure.
Yeah. First question. Is there a definitive answer for how long the vaccine lasts?
There is a definitive answer on nothing. I think we know that to be true. There's no definitive answer on anything. I know they've been doing studies to see how well our antibodies are holding up. And I think Dr. Joffrey, you actually kind of talked about it a little bit as to, if you have one vaccine versus the full dose and how that translates into protection against the virus. The problem is with so many variants, I think it's going to be hard to give any real concrete answers. And I think that in general, what will happen is that we'll just take the course of getting boosters and just keep riding that out. That's what I think will happen. I don't know if Dr. Joffrey, he probably has like numbers and whatnot, but
I have numbers.
I know you do.
They all lead to where you landed. In other words, there was an Israeli study and it looked at those vaccinated. Unfortunately, what it told out, those who were completely vaccinated, by the way, those in Israel, they were all vaccinated only using the Pfizer vaccine, only using the Pfizer vaccine. Unfortunately, what it showed was that after being fully vaccinated, it's only about 30% effective against the Delta variant. Mm-hmm. Not only that, the study highlighted something. It showed that those who were vaccinated in January had about 16% immunity. Those in February was about 44% immunity. Those in March about 67%. Those in April about 75% immunity. What does that mean? There's a waning immunity. Hold on now. But then a UK study, they came out with completely different numbers, meaning that it did not seem to wane as fast. So we're trying to figure it out. So to the Dr. Chen's point, we don't really know because we're getting contradictory studies in different countries. So we have to figure this out. What we do know is that being vaccinated protects you against death.
Yeah.
Yeah. Now, I've heard recently that there's a plan or an idea, a thought concept that those that took at least the Pfizer vaccination may have to go back for a third shot, a booster. Is that really to help improve those numbers that you just kind of rattled off there about, the waning and, the percentage of immunity? Is that to help essentially boost those numbers?
Yes. Now a PhD trained virologist, a Black woman, Dr. Cindy, who I've done a number of shows with, she likes to highlight this. We're only measuring a piece of the immune system. Let's just say there are 500 different pieces of the immune system. We're only measuring about 2 or 3 different pieces of it. So while it may show that it's waning, what about those other several hundred pieces that we're not measuring? Right. They could actually be doing just fine. But based upon what we are measuring, it sounds like there's a decrease. And yes, a booster shot that will help bring those numbers back up.
I heard that by the end of the year, they're going to try to have a booster for those that are 50 and over. That's kind of floating around. Not sure if that's going to happen, but.
Wow. So I won't be eligible. I have to, when are they going to have one for 40 and over?
Now I know you did not even try us.
Oh, okay.
Right. So you're not going to be able to get it till next year, King Joffrey. Okay.
Right.
I mean, so stay indoors, don't go nowhere, and wear a mask at all times because you're going to be at risk. Okay.
The next question we have is, what is your, I just lost it. They're scrolling fast. Okay. What is your advice to healthcare workers that don't trust the vaccination?
Get out of healthcare.
You gotta be kidding me.
Get out of healthcare.
You gotta be kidding me. You gotta be kidding me. I don't even understand the logic in that. How are you in healthcare if you don't believe in nothing you're doing?
Exactly.
You're a practitioner of medicine.
I saw them out picketing about, it's my right to not be vaccinated and be employed at the same time.
You know what? So this was the argument I had with one of my coworkers because she was upset that she could possibly lose her job if it's a mandate that our hospital system says, you're vaccinated, you can stay. You're not vaccinated, you have to go. And I was like, well, listen, every business runs its business the way they want to, right? And if you choose to work in that business, you have to abide by the rules, right? I don't understand. You don't. And here's the thing. You don't have to get it. If you don't want the vaccine, you don't have to get it. But just like anything in this country, that you're supposed to do and you don't do it, there are repercussions. So if you love your job, then you might want to consider getting vaccinated. That's just what it is. Now, I will say, I don't believe that people will get fired. They'll probably have something where you have to be tested every 3 days if you want to stay with the hospital system or wherever you work, if you don't get vaccinated. But the logic behind healthcare workers not believing in what they do, to me, just makes no sense. So I agree with Dr. King Joffrey that if you ain't in it to win it, then why are you in it? Don't make sense.
Yeah, and then there's a little secret that the audience doesn't know if you're not in healthcare. They already mandate us to get a flu shot. If you want to work in that hospital, you gotta get a flu shot. Now, I'm sorry, they don't mandate us. They just say, hey, you're free to work here as long as you're vaccinated. If you're not vaccinated, have a good day. So that's not.
What about the TB? Do y'all still do TB screenings?
Yes.
We still have to do PPD. We still have to do that. If you want to work, you got to have your PPD to make sure you don't have TB. That's part of working in the healthcare system. It's part of the rules. They want to make sure that you're not infectious, in which case you could infect other people. And that's the rules we follow. And if you don't want to follow them, then why are you in healthcare? You should believe that this stuff that we do makes sense. You should believe in the medicine, the science. And if you don't, I don't think that this is a place for people who don't believe in that.
So let me ask you a question, Conley, for the person. So if you're in healthcare and you don't want to get vaccinated, I'm honest. I'm being sincere. You should probably start looking for a different job, because I have a feeling that most healthcare systems, Trinity Health, a 42-bed hospital system, a few others, they've already mandated their employees to be vaccinated. And not only that, we're in the business of healthcare, protecting and saving patients. If you're a healthcare provider who's interacting with immunocompromised, autoimmune people who are not able to get vaccinated, and you are not vaccinated, that means that you can be passing the virus to them.
Yeah, absolutely.
Yeah. So I hear it. I hear your concern. But fortunately, this is America, and you can get out of healthcare and you can go to another field, and we thank you for your service.
Yeah, but I think
wait. How you gonna fire this person? Right on. You can't fire them. Thank you.
You picked up on that.
I think it's gonna get to a point where all businesses, I don't care, corporate America, healthcare, education, they're going to require. It's going to be, I hate to say it, I almost see it like the land of the vaccinated versus the non-vaccinated. And you will have a job if you're vaccinated. If you don't, you might not be work. I mean,
especially if you're in the business of service, you have to come in contact with so many people. It just doesn't. I mean, if you think about it logically, it doesn't make sense to not be vaccinated, especially if you're in healthcare, where you have to be taking care of people, saving lives. How are you doing that and giving them COVID at the same time?
Thank you. Yeah, I can see it. Law enforcement, they protecting and serving. Oh, but I might give you the virus.
I mean,
I'm arresting you. No,
it don't even make sense.
It doesn't. It just doesn't. And
you're gonna be in the NICU taking care of infants, premature babies, and you decided you didn't want to be vaccinated because you think they putting a chip in you. Girl, you better beat it. You ain't finna be next to my baby.
I know that's right. I know that is right.
Tell me.
Yeah, so I see it getting. If we do not get to the numbers we're looking for, it's gonna get ugly, because it's gonna force the hand to make people make that hard decision. And really it's for their own good. You're saving them from themselves, and you're also saving other people. It's one thing if it was just you, and if I don't get it, then if I die, and that's on me. But you could be just spreading it like wildfire and killing all kinds of people in your path. And that needs to be tightened up. It can't continue that way. I mean, we can't live that way. We'll never get to herd immunity. We won't get to the numbers we want. There's going to be I foresee some strict mandates put in place, and it's going to be real uncomfortable for some people.
Mm-hmm.
Yeah, here's a news flash. We won't reach herd immunity. It's just not going to happen. Especially given that with these new variants, it says that about 90 to 95% of people are going to be vaccinated. It's just not happening. Now, I do want to appeal to Black folks. I'm a Black male. And I can just say this: the newest data shows that about 67% of our white brothers are vaccinated, and Asians have a similar type of number, but it looks like only about 12% of Black folks are not vaccinated. Hey, I'm
Well,
yes,
Wow.
and I understand. Believe it or not, I understand. Many of us want to point to the fact that the Tuskegee experiment, and it's because that's simple. But what it really is how the healthcare system treats me and you to this day if we walk in tonight. Studies show that they don't treat our pain as aggressively, make us wait longer. We don't see the same primary care doctor. They don't take us for the emergency procedures as fast. So I get it. You all are right. And given that I am in that system, I apologize on behalf of that system. I am deeply, deeply, deeply sorry. But I must humbly ask you that in the interest of your family and in the interest of the world, because the world needs you, this is one of those times you gotta trust science. You gotta trust science, because that's what the vaccination is. And you already trust science. I can prove it. You go to your primary care doctor, and if you get in an accident tonight, you're gonna come and see me in the ER. And if you're real sick, you're gonna go see Dr. 10, and she's gonna put a tube down your throat. So you do trust science. So I would just again apologize for how the healthcare system treats us, but this is one of those times that you want to do what's in the best interest of you and your family, and that's to get vaccinated.
Yeah. We got these questions rolling in. Here's the next one. Were there any underlying conditions for those who died from the COVID-19 virus, or was it specifically from COVID?
yes and yes.
Mm-hmm. Okay. The next one, this is a statement: I've never stopped wearing mine, meaning the mask. But here in St. Louis, they reinstated the mask mandate.
That's good.
Next one is, what is the best resource for modeling prevalence and death rates? What forecast tool did you use to predict 3,000 per day deaths and is it open source?
It's a very complicated question. It's you can go to Johns Hopkins COVID site, but there is 3 or 4 different articles that I looked at that they all model the same thing. I'm not sure if it's open source, but yeah, it was in a few different articles.
Okay. This one is from Derek Massey.
There.
So if an unvaccinated person contracts COVID and goes to the hospital, can they then be given the vaccine to attack the virus, or is it too late?
It's too late. Here's why. From the moment you get, and this is why you hear about people saying that they were vaccinated and they contract COVID. Now, everyone listen to this. It's real simple. Once you're vaccinated, it takes your body about 2 weeks to build up any type of antibodies. Antibodies are those fighting cells, those troops who are ready to come and help. It takes 2 weeks. And then you need to get that second shot to get more troops. And so it's only after about 2 to 3 weeks after your last dose that you are fully vaccinated. And by the way, we have and maybe Dr. Tin can comment about it, we have a culture within medicine that when you're sick, acutely ill, we don't vaccinate you. We've got to wait until you are now healthy and your immune system is back to normal.
Yeah, you can't even get a vaccine if you've had a vaccine a week ago. You still won't get a vaccine. So if you were vaccinated with the flu vaccine day 1, you can't wait to day 6 and have a COVID vaccine. You got to wait. You got to wait that out a good 4 weeks.
Mm-hmm. Oh, speaking on that too, there's certain other procedures that I know that require you to have a 14-day space between when you got the shot, your last dose and getting, say, a cortisone shot. I guess there's some data that suggests that can somehow interfere with I don't know if it's the potency or if there's some side effects or whatever, but I know that, so be sure that whenever you're going to get anything done, that you tell them, I just had the vaccination, or, I'm past the date or whatever. They may ask, they may not. I found that out that, yeah, there's certain procedures that you need to wait it out. Now, I know someone who got the first dose and then they got tested for COVID and they were positive, and they would not give them that second dose because they were already, infected. So just some other things to think about there. The next question here, this is from Marvin Bembry, and he is a pastor, and he has a question regarding the church. So, docs, what are your thoughts on protocols regarding church assembly, sharing of microphones, and I guess passing of collection plates and so forth?
I would say if you pass in a mic, you need to disinfect it before you do so. Have is the smallest amount of people touching the mic as well, even though you disinfect it in between. I would say don't pass around a collection plate. Have a plate somewhere where people can throw in the money, so nothing has to be touched. And if you're indoors having service, everybody should have a mask, and they should be seated 6 feet apart from each other.
I actually think it's sinful to have indoor service during this phase. Really. I just think we've gotten used to online services, and if your church was not online, you've had plenty of time to it. But small gatherings, large gatherings, that's what's going to do us in, especially if you're talking about the Black church. We already talked about that many of us are not vaccinated. Actually, I would not have indoor service at all.
Yeah, I know some pastors are actually doing outdoor services, which is spread apart, gives you that distance. I think that if you're going to have in person, that's definitely the best approach, is spread it out, keep it open.
But if you are going to have it indoor, I would do what Dr. Ten said. Everybody should mask up. I prefer N95s in that case. Nobody touching anybody, but I can tell you, someone's going to contract COVID. Guaranteed.
Well, with all that singing going on, somebody is spraying somewhere. All that, no singing in the church. Okay, if it's an indoor service,
that's
singing,
a good point.
No singing.
Yeah, I've seen
actually
choirs they've stopped doing the choirs for.
Yeah, singing is the number one way of transmission through saliva. Singing is number one, talking and breathing. And I think singing was like 60% transmission rate.
Yes.
It was the number one way of transmitting it. So no singing in the church. I know that's going to kill some of y'all Black folks, but y'all better play a tape recorder, have a DJ in the background.
And so while Dr. Ten is being kind of tongue-in-cheek about it, she's absolutely right. Singing is the number one largest way to eject particles. That's the one thing you should not do. The next one is simply talking, and then breathing. Breathing is the next easy way. So, Pastor, whatever you do, please don't sing indoor without a mask. Please don't sing indoor at all.
Don't sing
at all. And if you can move it outside,
still don't sing.
Yeah, good point. Still don't sing.
Y'all can hum. Yeah. Y'all can hum real loud, but that's it.
I hear that. Just a shout out from Scott Pierman to Joff, Dr. Joff, King Joff, or however you want to call it, for A5A. He's just giving you the sign.
My man.
Okay, where are my deltas at? Come on, ladies. Where my deltas at?
Okay.
Appreciate it, brother. My man.
Okay, next question. How long for vaccination approval for children under 12?
Ooh, that one I am not sure about. Dr. Joff.
And actually, no one's sure about it, but it's looking like it's not going to be this fall. Last I read, it's not going to be prior to school. It's going to be late fall, early winter. So in other words, you've got to answer the tough question. Are you going to send your child back to school unvaccinated?
Because our schools are open. I don't know about yours.
Yeah.
And by the way, for you parents who have to work and you've got to send your kids back, it is what it is. But for those people who have options, I would say there's 3 criteria that I would recommend. 3 criteria. One of them is that you will require your kids to wear. I mean, it would be nice if the school require all the kids to wear masks. It would be nice if the school required all the teachers to wear a mask. Mm-hmm. And then finally, they should have a plan for if a student shows COVID symptoms while in school, what is the plan? Because that child needs to be isolated right away, and there needs to be an area that's already set aside and for that child, probably for like multiple children.
Yeah,
that's a good point. The next one here is a post from Scott Pearman, excuse me. He actually pointed to a link called Vaccine Mythbusters from Dr. Ramon R. Scott. Just as a reference for people if they want to see some of the mythbusters that are out there. Okay, next question. If you are a breakthrough case, is there anything wrong with your immune system? Is there anything else to do to protect yourself?
So,
Dr. Joffrey, this is all up your alley. Vitamin D and all that. Go ahead, let them know.
Hey. Well, first of all, we can use breakthrough because that's what the pundits are using. But there's really no such thing as breakthrough. You simply had a case because when you were vaccinated, you may still contract COVID. So it's really not a breakthrough case. And then if there's anything you can do, all right. Look, there's been one vitamin that's been shown, evidence-based, peer-reviewed data. Vitamin D has been shown to be not only protective, even contracting COVID. People who have normal vitamin D levels are 2 times less likely to even contract COVID. And people who have normal vitamin D levels do much better if they contract COVID. In fact, studies show you were 9 to 11 times more likely to die if you contract COVID if you have low vitamin D levels. The lower, the greater the risk. So I would encourage you. Most of your vitamin D comes from the sun. I would encourage you to get plenty of sunlight. And then talk to your primary care doctor about starting vitamin D supplements. I know that Dr. Fauci, he takes 6,000 units a day. I take 10,000 units a day, but it's not medical advice. This is just for information purposes only. And then exercise is absolutely key.
That's a good point. Yeah, I started taking my D after hearing one of your sessions, Dr. Joff, on, basically people are dying because they did not have that vitamin D deficiency. Not just because of that, but that was, a factor. So I've been religiously taking that. And I don't remember the amount. It might be about between 6 and 10,000. So it's pretty strong. And I've been okay so far, but we're getting into fall. We're going to be coming up on fall, which then brings your fall allergy season. Now folks are going to be confusing because this Delta variant kind of can look like allergies. And, some people might be walking around, oh, that's just my allergies. It's not COVID. And, that's going to be something.
I think too, where we failed the first time around when COVID hit us back in 2020 in March, one of the biggest regrets I know that a lot of people in the CDC, the NIH said was that they didn't do testing enough. Yeah. They failed with testing because by the time you show symptoms, you've already been infected and spreaded it to how many other people. So I think what's crucial with the Delta, with any of it that's coming down the pipe, is testing. And I think that actually we should have more regular testing done because by the time we catch a symptom, we've already infected 8 people. I think with the Delta variant, one person infects 8 people. Before with the Alpha and the Wuhan, I think it was one person infects 4. Now it's 8. So for every one person, you infect 8, and each one of those infect 8, and so on and so forth. So by the time you've infected these people, you're just finding out you have symptoms. I think where we failed is the testing. And I really think there should be a push to have testing at work sites, in churches, places where people congregate. I think there should be more of a push to have that access just as available as the vaccine. That way we can kind of chop it off before it even starts. Get tested before you even show the symptoms and start spreading it to everybody.
So how reliable are those like 5-minute tests? I took a rapid test to go visit a relative in a senior living community, and they gave me the 5-minute test, with the nose swab, and then I mean, are those really accurate?
If they're positive, they're very accurate. If they're positive, they're accurate. If they're negative, they're about 60 to 70% accurate.
Okay. So they did that.
But it's more accurate than no test at all. So,
yeah. Yeah. Okay, that's good. And just so Dr. Tin isn't left out, your soror, Tanya Davidson, is giving you a shout out here.
Tanya. All right, Tanya. Thank you, girl.
She felt compelled because you had to plead for it. My bad. I was like,
that's because we don't have to brag. Okay, we are reserved. All right.
Okay. Okay.
Y'all alphas like, oh, bro. We chill. Okay, we chill.
There we go, bruh. We're used to this hate, right? We're just used to it. It's okay. It's okay.
Oh Jesus. Whew.
No, Jesus was not alpha, so please.
Oh, you're right. He was an omega.
Oh.
Isn't he alpha and omega?
Let's move on.
Look, he was alpha and omega.
Let's move on.
We got one last question here from the group, and this one it says, is 6,000 to 10,000 units of vitamin D safe for kids ages 9 through 14, or should you dial back for kids?
I would say speak to your pediatrician.
Excellent answer.
Yeah.
Excellent answer. And get them in the sun. You will not overdose from vitamin D from being exposed to the sun. And 90% of vitamin D comes from the sun.
But wear sunscreen.
So that's an interesting point. So you've got to wear sunscreen, but if you wear sunscreen, just so you know, you don't get as much vitamin D. But you got to wear sunscreen, so it gets kind of dicey. Yeah.
I'm bad with that sunscreen. I'm sorry. I don't typically burn, but I guess it's good for everybody to wear it, I suppose. I like getting tan in the summer, and I'm afraid that I would lose some of my tanness if I put sunscreen on. So, I mean, I have like a low SPF, but yeah.
Have you, Michelle? Look, Black folks, the sun has changed from 30 years ago. It's burning us. It's causing cancer.
Yes.
We need sunscreen just as much as other folks.
I knew
it doesn't matter that you don't get burned, Michelle. It's not really about the sunburn. It's about what the UVA and UVB rays are doing to the skin.
Yeah.
It's actually almost like a virus because it makes your cells turn over at a rate that causes them to go out of whack and create cancers. So that's the problem. It's the cancers. It's not, sunburn. Yeah,
right.
It's about
that's a good point.
Cancer.
Yeah, that's something I definitely will keep in mind as I continue to travel safely to tropical areas of the world.
And another thing on that same note, totally unrelated to COVID, but wear sunglasses because I can't tell you how common it is to get cancer in the lower lids from the sun.
Really?
Oh yeah, we do surgeries on that all the time.
Wow.
Not uncommon at all to have cancer in your lower eyelid from the sun. So
and then people are afraid to wear the sunglasses because they look like raccoons because they have this white here and everything else is dark. But I hear what you're saying.
Yeah, it's pretty common. I've done lots and lots of surgeries to remove it for surgical removal of the cancer.
I did not know that. Now, we will be doing at some point a segment on women's health and men's health. And of course, I'm gonna, tap my favorite doctors here to see, when we get to that point. I do want to do the skincare class with you, Dr. Tin, because you have the new skincare line and you know a lot about skin, as you're telling me right here. And I think more of our brothers and sisters could take advantage of learning a little bit more on how to take care of their skin, because we say black don't crack. Well, we're gonna make sure that it doesn't crack. Right, we're gonna make sure you're using the right product, because that's true, it does crack if you're not doing the right things.
Yeah, no, that would be great. I would love to do it. And it's for women and men. Our skin is the same. There's no difference. It's still a bunch of cells, protecting our bodies. So we need to inform people on how to take care of it. So absolutely, I can't wait till we do it.
Awesome. Well, I think that's our show. As always, it's been a pleasure having you guys here. I just love the interaction, the back and forth, the education, the information, the comedy, all of the above that makes this show worth watching. And I'm sure that those that are watching here live and those who will watch the replay will really appreciate this information. I see feedback already saying, thank you all, great information, thanks, excellent info. So this has definitely made a difference. I think the purpose has been served of what we were trying to accomplish tonight. So with that, any last comments from either doctor before we close?
You know what? I would just say stay informed, do your own research, wear a mask at all times. Remember, mask up. We talked about that the last time. It's like being out in these streets and wearing a condom. A mask is no different. Protect yourself at all times. And if you don't have to go out, stay indoors.
Thank you for that. I absolutely agree. I think if you don't learn anything else, and that is start to wear a mask. That's you, your families, your loved ones, and guard your house. Guard your house as if COVID's trying to get in. And so I would encourage you to limit the number of people who are in your house. I would encourage you to anyone who does come in your house, make them wear a mask. And for those of us who have teenagers, it gets a little frustrating. People talk about these little kids who will not put on masks. These teenagers are a little more difficult. And there's one other point that I've got to mention, everyone, is that while you're protected against against death if you're vaccinated, you can still contract COVID. And the problem with contracting COVID is that now you're open to long haul COVID. Long haul COVID is simply you've had COVID, you've cleared your body of active COVID, you still have symptoms 12 weeks later. The most common symptoms are shortness of breath. So there you have athletes who are just so short of breath that they can't even walk all the way down the street. You've got people who have generalized fatigue. They're so tired, they've got to go on disability because they can't go to work now. Something called brain fog. You're trying to figure out what you're saying. Brain fog is real. And for the fellas, it causes erectile dysfunction in up to 20% of people. 20% of people erectile dysfunction.
That might be enough to get them vaccinated.
That's all they want to hear. ED? Oh, right. Yeah, I ain't fooling with ED.
Right. Yes. So thank you so much again for your time. And this was real short notice. And I just appreciate that both of you had a very flexible yet very busy schedule, but that you thought that it was important enough to come tonight and talk to our SMAC Nation. So with that, I will give my thank yous again, Dr. Tin, Dr. Joff, everyone out there in SMAC Nation. Thank you for your time. And I hope you learned something this evening that you can take back to your friends and your family. And that is the end of our show. Take care, everyone.
Bye-bye.
Thank you. Bye. Have a good one.